Hi guys, welcome back to my channel. This is Dr. Rajeshwar from yrpharmatube. In the previous video, we discussed oxazolidine type of anticonvulsant drugs. If you did not watch the video, hit the I button on top right of this video to watch it. To watch the other topics of anticonvulsants and the other subjects of pharmaceutical sciences, click on the links given in the description box right below this video. In this lesson, we shall learn about the fourth type of anticonvulsants, that is Succinimides, and the individual drugs such as Phensuximide, Methsuximide, and Ethosuximide. At the end of this video, you will be able to understand the Succinimides type of anticonvulsant agents and the specific individual Succinimide drugs such as Phensuximide, Methsuximide, and Ethosuximide. The Succinimides emerged in 1951 out of a systematic search for effective agents less toxic than oxazolidine diones for the treatment of absence seizures. Succinimides are a group of drugs that are derived from the amide of succinic acid. It is a dicarboxamide and succinimide that contains a 5-membered fully saturated heterocycle pyrrole, that is pyrrolidine ring system, which is substituted by two oxo groups at positions 2 and 5. Thus, it is a pyrrolidinone and a dicarboxamide. Succinimides refer to the compounds that contain the succinimide ring system, which is called 2,5-pyrrolidine diones. Several succinimides are used as anticonvulsant drugs, including Phensuximide, Methsuximide, and Ethosuximide. They all contain a basic structure to those of the hydantoins and oxazolidine diones, which are clinically established antiepileptic drugs. All these drugs are effective in the treatment of absence seizures, that is petit mal seizures. Phensuximide was the first drug to be introduced for the therapy of absence seizures. However, it is less effective than trimethadione and paramethadione, which are the oxazolidine dione anticonvulsants, and thus it is relegated to a secondary status. The other alpha-phenyl succinimide derivative, that is Methsuximide, introduced in 1956, which is more active than Phensuximide. However, neither of the two is now in common use. Ethosuximide, an alpha-alpha dialkyl succinimide, is the most active succinimide and is the most selective for clinical absence seizures. It is more effective than trimethadione and has lower risk of serious adverse effects. Structure-activity relationship studies of succinimides. Introduction of methyl and ethyl group at position C5 is effective in controlling absence seizures. For example, Ethosuximide. Introduction of a single phenyl group in C5 resulting in a loss of anticonvulsant activity. For example, Phensuximide. Phensuximide and Methsuximide have phenyl substituents which make them active against electrically induced convulsions. N-methylation decreases activity against electroshock seizures and impart more activity against chemically induced convulsions. Alpha-methyl alkoxy-phenyl succinimides and alkoxy-benzyl succinimides were active anticonvulsant agents. The length of the alkoxy group here determines the activity of the drug, while the unsubstituted succinimide seems to be inactive compound. General method of succinimide synthesis. Many succinimide derivatives are known which are having high anticonvulsant activity. Here is the general method for the synthesis of succinimides. A substituted ketone is initially reacting with ethyl 2-cyanoacetate in the presence of ammonium acetate, which are condensed in Knoevenagel condensation reaction forms cyanoalkanoate. This is then treated with either hydrogen cyanide or potassium cyanide, which produces a dicyanoalkanoate. This intermediate compound, dicyanoalkanoate, is upon acid hydrolysis and deethylation yields a dicarboxylic acid, that is a succinic acid derivative. Reacting this product with an amine or ammonia undergoes heterocyclization, forms the desired succinimide. The first drug of this class is Phensuximide. Phensuximide is an anticonvulsant in the succinimide class. Its IUPAC name is 1-methyl-3-phenylpyrrolidine 2,5-dione. It is a succinimide in which methyl group is substituted at position 1 and a phenyl group is at position 3. It is a member of pyrrolidines and succinimides with anticonvulsant properties. As discussed in the previous section, the general method of succinimide synthesis, Phensuximide synthesis uses benzaldehyde as the starting material as shown in the figure. In the last step, methylamine is used for heterocyclization of the dicarboxylic acid. In another method, Phensuximide is also synthesized by the reaction of phenyl succinic anhydride with methylamine. It is a solid and has melting point at 72 degrees centigrade. Phensuximide's mechanism of action is not understood but may act in inhibitory neuronal systems that are important in the generation of the 3 cycle per second rhythm. Its effects may be related to its ability to inhibit depolarization-induced accumulation of cyclic AMP and cyclic GMP in brain tissue. Phensuximide is also prescribed under the name Milontin. It is an anticonvulsant drug occasionally used for the treatment of absence seizures, that is, in minor forms of epilepsy refractory to other drugs, although it is considered to be less effective than ethosuximide. It should be used with caution in patients with acute intermittent porphyria. The next drug in succinimides class is Methsuximide. Methsuximide is also known as Methsuximide or Methosuximide. It is a succinimide anticonvulsant medication and its IUPAC name is 1,3-dimethyl-3-phenylpyrrolidine 2,5-dione. The therapeutic effectiveness of Methsuximide is largely due to its pharmacologically active metabolite N-desmethyl-methosuximide, which has a longer half-life and attains much higher plasma levels than its parent compound. It has a role as an anticonvulsant and a succinimide derivative. Methsuximide can also be synthesized in a similar way as Phensuximide, except that Methsuximide synthesis uses methylphenyl ketone as the starting material as shown in the figure. In the last step, methylamine is used for heterocyclization of the dicarboxylic acid, that is 2-methyl-2-phenyl succinic acid. Methsuximide is a white to grayish-white crystalline solid powder. It occurs as crystals from dilute alcohol. It is odorless to slightly odor and has melting point between 52 and 53 degrees centigrade. It is freely soluble in methanol, slightly soluble in hot water, freely soluble in alcohol and ether, very soluble in chloroform. When heated to decomposition, it emits toxic fumes of nitrogen oxides. The physiological effect of Methsuximide is by means of decreased CNS disorganized electrical activity. Methsuximide is sold as a racemate by Pfizer company under the trade names Petinutin in Switzerland and Silontin in United States. Although Methsuximide is less commonly used, it can be indicated for the control of absence seizures refractory to other drugs. Although it does not precipitate tonic-clonic convulsions, it often is combined with phenytoin or phenobarbital when absence seizures coexist with tonic-clonic symptoms. It may be used in the treatment of complex partial seizures. Methsuximide is considered to be more toxic than ethosuximide. And the last drug of this class is Ethosuximide. Ethosuximide was approved for medical use in the US in 1960. It is in the Succinimide family of medications. Its IUPAC name is 3-ethyl 3-methylpyrrolidine 2,5-dione. It is a dicarboxamide, that is pyrrolidine 2,5-dione, in which hydrogens at position 3 are substituted by one methyl and one ethyl group. It has a role as an anticonvulsant, a gyroprotector, and a T-type calcium channel blocker. It is a chiral drug with a stereogenic center. Therapeutically, the racemate, that is the 1:1 mixture of S and R isomers used. Similar to Phensuximide and Methsuximide, as discussed above, Ethosuximide can also be synthesized in a similar method, except that Ethosuximide synthesis uses methyl ethyl ketone as the starting material as shown in the figure, and in the last step, ammonia is used for the heterocyclization of the dicarboxylic acid. Ethosuximide is a white to off-white crystalline powder or waxy solid. It occurs as crystals from acetone and ether. It has a characteristic odor and has a slightly bitter taste. Its melting point is at 64.5 degrees centigrade and is freely soluble in water, very slightly soluble in solvent hexane. It is stable in light, air and heat at 37 degrees centigrade. When heated to decomposition, it emits toxic fumes of nitrogen oxide. Ethosuximide's mechanism of action is thought to be due to antagonism of the postsynaptic T-type voltage-gated calcium channel. Ethosuximide is sold under the brand name Zarontin. It is a medication used to treat petit-mal epilepsy, that is absence seizures, and is considered to be the first choice medication for treating them. It is not effective against partial complex or tonic-clonic seizures and can increase the frequency of grand mal attacks. Thus, it must be administered in combination with other anti-epileptic drugs such as valproic acid when treating persons with mixed seizure types. It is an anticonvulsant drug that is used in minor forms of epilepsy. It can be taken by mouth. This is the list of references followed for the lesson. That's all in this video. The Succinimides type of anticonvulsants and individual drugs such as Phensuximide, Methsuximide and Ethosuximide. In the next lesson, we will discuss about the urea and monoacyl ureas of anticonvulsants. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.